you're watching this video because we told you have some arthritis in the knee and may need a procedure for it. Once again, our whole process is that we want to try conservative modalities and see if you can tolerate the symptoms the way they are. We can do injections with steroids, which decrease the inflammatory process inside the knee, or injections with lubricant, which can lubricate the joint and hopefully prevent you from needing any surgical procedure on the knee. However, sometimes the cartilage does wear out. And if it wears out to the bone and you get bone-on-bone contact, that is when the cartilage wears off the femur and the tibia and the bones are touching. That gives you a big grinding sensation and significant amount of pain associated with it. While in the shoulder, you sometimes will tolerate that. In the knee, because you're stepping on it every step of the day, we oftentimes do a little bit more aggressive as far as replacing. I personally don't do total knee replacements. I stopped that many years ago, but I do partial knee replacements with the Mako robot. If you get arthritis in either the lateral or medial compartment or the patellofemoral compartment in isolation, meaning the other compartments aren't involved, I will replace one of those compartments. The way we do it is with robot assistance. You've probably seen the commercials on TV. Essentially, there's a three-dimensional image of your knee that's up in a computer, and we do a verification process. We put arrays in both the tibia and femur, and then we do point verification to determine exactly where the bone structure is. And using the help of the computer, we can see what the pressure is going to be on the implant as it's through the range of motion. What that does is that balances the knee nicely, takes any surgeon error out of it, and we just burr off the appropriate amount of bone to implant the partial knee replacement so that you can go on functioning. Our hope is that you won't need that, but if you do, we're here for you. There are other cartilage procedures that sometimes we do before the partial knee replacement. If you have a traumatic injury, like a motor vehicle accident, where your knee hit the dashboard, sometimes you'll delaminate the cartilage. When you impact into the bone, it sometimes breaks the cartilage off the underlying bone. So we sometimes need to do something to stimulate growth in that area. One of the things we can do is called microfracture, where we drill small holes in that area and primitive mesenchymal cells will come out and form cartilage over that region. It is not the same kind of cartilage, it's not hyaline cartilage, it's fibrocartilage. So while it covers the defect and it decreases the amount of swelling you get, it still doesn't have the same qualities as a hyaline cartilage. In addition to that, there's a procedure called MACI. It used to be called Carticel. It's a two-stage process, especially if you're young with a large defect. We essentially scope your knee, we evaluate the size of the defect, and determine whether you're a candidate for it. With the MACI procedure, we take biopsy of your cartilage, we send it off to the company, they denature it, and they grow it, and they repopulate it on a collagen graft. And then we insert that into your knee, so it's your collagen growing in, and that can hopefully get you out further before getting a partial knee replacement. This is all age determined. You really don't want to do a partial knee replacement or total knee replacement in a young individual, because invariably all of these will fail at some point in time. And so we want to make sure that we use it for the appropriate person, but this is a discussion that we'll have in the office or in the OR, depending on what you want to do. So this is about the partial knee replacements, both the lateral, medial side, in the patellofemoral area, and MACI procedure, as well as abrasion condroplasty. Any questions, let me know, and we'll see you in the OR.